Welcome back. This is video 2 of 4 on the 4 P's of a smile above smile design. Today I'm going to cover the second P, position. This is a somewhat detailed component, but it's very important in achieving great results. If you're considering improving your smile, position will be very helpful to understand. So the second P of smile design is what I've entitled position. And when we're talking about position, there are really 5 different items that we can talk about. The central incisors, or the front teeth, the midline, and by this I mean the midline of the upper front teeth. I'm going to talk about axial inclinations, and I'll define that for you in a moment or two. There's arch form and also smile arc, and I'll just explain what each one of these items is as we go through them. So here's a smile that illustrates ideal position. The teeth are in the right position, the midline's in the right position. All the individual components that make up position are illustrated here in what is a very attractive natural smile. Here you can see the central incisors, the front teeth, are positioned ideally in terms of their relationship to the lower lip. The incisal edge position, or the biting edge of the front teeth, should be close to the lower lip, and the contours of the teeth should follow the curve of the lower lip. Determining the incisal edge position of the front teeth is a very important component of smile design. You can see it's not just about appearance, but also about speech. Our front teeth are very closely connected to how we speak, and the phonetics involved are crucial. Making the F or V sounds helps determine where we put the incisal edges. If we don't get it right, people will have difficulty making this sound. We want the biting edges or incisal edges of the front teeth to just barely touch what we call the wet-dry line or wet-dry border of the inside of the lower lip. So this getting patients to make this sound, F sounds or V sounds, will help determine where we put the edges of the front teeth. The other thing that helps determine where we put the edges of the upper front teeth is what we call lip at rest. So here you see a young man who has a nice smile, nice position of teeth while he's smiling. And if we get him to relax and not smile and just be in a restful position, you can see that there are several millimeters of his front teeth showing when his lip is at rest. Now this is a young man in his early 30s. You can see here what happens as we become a little bit more mature. Again, a nice smile in smile position, but when the lip is at rest, because the lip tends to flatten a little bit with age, and also our teeth often wear a little bit with age, there is less of the upper front teeth showing when the lip is at rest. So in order to make the smile look a little bit more youthful, we want to often lengthen them a little bit. Here you can see how worn teeth can make a smile look older. And a close-up of this, this is not a particularly attractive smile. Part of the issue is that the teeth are worn here and a little bit too short. So if we go back to this lip at rest position, you can see that this gentleman, when his lips are at rest, there is nothing showing of his upper front teeth. And this tends to make an older smile that is less attractive. So when we restore these teeth, when we put the temporaries in place, which are worn during the period of time that the crowns or veneers are being fabricated, the patient is wearing temporaries, or provisionals as we call them, and during that time we can determine if the length that we've chosen and the position that we've chosen for the upper front teeth is correct. So here we see temporaries in place, and we've decided that the length for this gentleman is pretty much where we would like it to be. So here is the final result, and the proper length of these front teeth restores a much more youthful appearance. So here you see the before on the left and the after on the right, and restoring proper length and position to these front teeth creates a far more youthful smile than this gentleman had before. Again, this is the smile. Same gentleman from the side. You can see that the position of the front teeth is just above the lower lip and follows the contours of the lower lip quite nicely. The second item I want to talk about in terms of the position of teeth is what we call the midline, and I'm referring here to the midline of the upper front teeth. The midline of the upper front teeth is very, very important. It's not always in the center of the face for various reasons. Teeth can be missing and things can have shifted, but if the midline is actually canted or not straight up and down, it becomes very noticeable and quite unattractive. So here on the left, you can see a midline that is shifted off significantly to the patient's left-hand side. Plus, it is also canted. It goes from her upper right to her lower left at a slant. So on the right side, we have moved the midline a little bit over to her right-hand side, corrected a little bit, although that's been limited, the amount that we could actually move it over. But more importantly, we've shifted it so that it is upright. It is perpendicular to the horizon, or it bisects the long axis of her face. And by doing that, taking away the cant and making the midline upright, it detracts from the noticeability of the shift of it to one side or the other. So here you can see the midline cant, and here on the right-hand side you can see the improvement when it's made upright. Again, another example of what's not attractive when midline is canted. On the left, you see a photograph where the midline is canted off to the lower right-hand side, and how much better it looks when it's made upright. This is a very, very important principle of smile design. The next topic under position are something that we call the axial inclinations, and by this we mean the inclination of the long axis of the tooth. The tooth comprises a crown and a root, and together those have an inclination. The upper front teeth should have an inclination that is pretty much upright, almost directly straight up and down. And as you move back in the mouth to the lateral incisors, which are the next teeth in line, the long axis should just incline slightly towards the midline. The canine should incline slightly more towards the midline, and every tooth behind that in the mouth should run basically parallel to the canine. So this is a diagrammatic representation of ideal axial inclinations. Here you see a group of teeth that are illustrating pretty much ideal axial inclinations, where the front teeth are upright, the lateral incisors incline slightly, the canines slightly more, and the teeth behind them incline slightly more, staying pretty much parallel to the canines. I also call this the belly button rule, where everything basically points to the belly button. So the front teeth, which are directly above the belly button, point straight down, and everything as you move sideways inclines slightly towards the center. Here you see an example of a smile that before it had been treated had axial inclinations that were incorrect. The teeth, instead of pointing towards the midline or towards the belly button, were actually pointing out towards, say, the hips, and it gives the smile a somewhat unideal or undesirable appearance. The after photo on the right, you can see where the axial inclinations have been corrected, and everything points pretty much towards the center. Here's a close-up of that same smile, the before and the afters, and you can see the axial inclinations on the left are kind of all over the place. Some are pointing outwards, some are pointing towards the middle, and there's a little bit of a hodgepodge, whereas afterwards everything has been corrected, and it gives the overall appearance much nicer appearance. And then this is a little bit taking things to an extreme. You can see what happens when all the teeth are pointing in the wrong directions. This is just a joke, of course. Poor baby. The next item under position is arch form. And here we can see a smile that has had 6 veneers placed, and how when arch form is not corrected properly, the result is less than ideal. So by arch form we mean the curve of the arch, and I'll show you another photograph here from a different angle. The one on the right is what we're talking about, the form of the arch. It should form a nice even horseshoe kind of shape. And in this case, the eye tooth on the patient's upper right has been left out of position. It's crowded out of the arch form, and it has not been corrected prior to the veneers being placed. So the overall appearance of the final result is not attractive. So we need to correct the arch form when we're preparing these teeth. Anything that is out of position in terms of being too far forward or too far behind the arch needs to be prepared and adjusted in order to create the best smile. Here is another example of poor arch form. This is often a result of crowding, as you see here. Some of the front teeth are behind the ideal position on the arch, and some of the other teeth are outside the ideal position. So here are 3 photos that show on the far left the before treatment position, and the middle photograph shows how the arch form has been corrected during the tooth preparation. So the teeth that are behind or too far inside the arch have been trimmed back a little bit, and those that are too far out of the arch forward have been trimmed back as well. So the arch form has been corrected prior to the veneers being placed on. And on the right side, you can see the result, how the 4 teeth that have been prepared and covered with veneers are now nicely aligned. The next topic under tooth position is what we call the smile arc. And here is an example of a pretty ideal smile arc. And by that we mean the arc that is formed by the edges or biting edges of the teeth, as you see here. Here is an example of a smile arc that is less than ideal, and it's what we call a reverse smile arc. As you can see here, the front teeth and the teeth beside them, the lateral incisors, are actually shorter than the canines. So instead of following the curve of the upper lip, as you see in this photograph here, where the edges nicely follow the curve of the lower lip, in this case, the smile arc is reversed and do not follow the curvature of the lower lip. And this is not considered to be an attractive arrangement. So here you see a case where the smile arc on the left was incorrect, and following both Invisalign treatment and veneers, we've corrected it so that it becomes much more attractive. Again, an example of a reverse smile arc where the front teeth, the 4 front teeth, are shorter than the remaining teeth. And here is the smile restored, where bonding has been done on the 6 front teeth to correct that, to lengthen the 4 front teeth somewhat and bring them into a better relationship with the eye teeth and the other teeth behind them. So that covers the second P, position. As I shared, there are 5 components to position: central incisor position, the midline, axial inclinations, or the long axes of the teeth, arch form, and smile arc. If you have any questions on these, just give us a call and we'd love to connect for a private consult. In the next video, I will cover the third P, proportion.